Okay, so a quick overview of how the medlock works. If we wanted to pressurize the medlock down, I would close all of these dogs on the hatch. Put all these dogs onto the hatch and make sure that they're sealed. And then I'm going to ask my occupants on the inside to open the medlock equalization valve. That is a valve we looked at on the other side here. I'm then going to open my supply valve, and that's going to take the chamber air, go through the gauge here, down through this tubing, and up to the inside right here, and pressurizes up into the medlock. That is going to equalize the medlock with our chamber. So the occupants on the inside then would be able to open their door. They would take whatever device I put in there, and then they would exhaust it. Now, opening the medlock or bringing it to the surface, I would instruct the occupants on the inside to close the medlock equalization valve. I close mine on the outside. This hatch is closed. I then open this valve here, which is my exhaust valve. That valve will take any gas that's inside this small chamber and quickly exhaust it and vent it out. The gauge returns to zero. The medlock is at the surface. I close my valve, and I then open my dogs up. Once all my dogs are open, I can then open the medlock door. You can see that this is an external sealing hatch. And there's the O-ring there. I then can take out whatever device I'm going to put in. This happens to be a urine bottle. This is what divers will use to urinate in during a treatment. It has graduated marks on here so we can quantify how much urine output the patient has. Put an empty one in here, close up the medlock, and the process goes over and over again. Very important that we keep the medlock shut and dogged when we are not using it. And the same thing with the hatch on the inside. It is shut and dogged when we're not using it. Okay, in using the medlock here in DDC1, again, DDC1 is outfitted with the medlock, DDC2 is not. This unit right here we can use to transfer small items in and out, such as some IV fluids, Gatorade, oral fluids, medications, IV bags, etc. The way that this works is we use the chamber pressure to pressurize the medlock. This medlock equalization valve I must open in order to give the operator on the outside pressure to the manifold we looked at earlier. So this valve is open. He opens a valve on the outside and it will send pressure down and equalize on this side. Okay, so what we'll do is this valve will be open. We have pressure into the chamber inside here in the medlock. We will open the dogs and then simply open the hatch. Once the pressure is equal, regardless of what depth we're at, we should be able to open the door. The door is sealed. You can see there's an O-ring seal here. We need to lightly keep this lubricated with some silicone grease and make sure that our metal surface is smooth. We remove our device and we do not leave the medlock open. We want to shut it immediately, close it, and then we'll dog the hatch. Now you're going to lightly close these right here, and then you're going to instruct your operator to exhaust the medlock and bring it back to the surface. So all you're going to have to do is hold this here and tell them that you are ready for them to dump the medlock on the outside. I'll make sure that this valve is shut. And we're holding the hatch. They vent the medlock or exhaust it, and the medlock comes to the surface. Now pressure is pushing on this hatch, and these dogs are no longer necessary to hold the hatch in place. They're just temporary to put it onto the O-ring. So these dogs, you don't need to sit here and cinch down these things too tight.